Summer is approaching. That means more exposure to the sun, so it's time to start thinking about protecting our skin. And rosacea is a common disorder that causes redness in the face. Dr. Daniel Carrasco is a dermatologist and joins us today to talk about some of the warning signs and the treatments that are available out there. Thank you so much for being with us today.
Sure, absolutely.
We also brought some props, some food and drinks.
The reason we have these props out is because a lot of people don't know they have rosacea, and rosacea is a disease of the skin that can be manifested as a rash on the face. There's sometimes bumps. It can be associated, sometimes confused with acne. So 16 million Americans have rosacea, but about 80% of them don't even know they have the disease. So this is sort of an example of some of the triggers that can trigger rosacea. For example, wine, salsa, being here in Texas. So these are very common things we do that can trigger the disease.
Now, are these only in excess or just even the smallest amount?
Even the smallest amount can do it.
Is that right?
So, just a little bit can trigger the redness and flushing on the face.
Now, who is susceptible to rosacea?
It turns out that Caucasians are more susceptible, but anybody can get rosacea. So it's not just one particular subtype, but it is in fact, all kinds of celebrities have it. And for example, Bill Clinton has rosacea, Cynthia Nixon has rosacea. So these are people that commonly have it that we know and we understand. Now,
you mentioned detecting it is part of the problem. It's often hard to detect. So what are some of the warning signs?
It's hard to detect. Some of the warning signs can include just redness, like pimples on the skin, sometimes some flushing, and especially when you go outside and exercise, you come back red. That can also be a trigger too. So it can be sometimes confused with acne. So, a lot of times people think they have acne, but they really have rosacea.
Now, this is not to be confused with just simple overheating, I guess, as well, if you're out in the hot sun.
Right. It's not overheating. It's kind of a persistent redness that you get. And so I think the most important thing here is knowing that there are great treatments options available through your dermatologist. RosaceaFacts.com is a website that has a lot of information about the disease state. But a lot of the over-the-counter medications can actually worsen rosacea, so sometimes it's good to find a dermatologist that actually knows to diagnose you properly to be able to treat the disease correctly.
There is no cure, but there is treatment options.
There is good treatment options, including creams and some pills and more other cases, but yes, there are good treatments.
And why is Texas so susceptible?
Well, we have the perfect storm for rosacea. We have a lot of heat. We have a lot of people that do a lot of exercise. We have a lot of spicy foods. So it's kind of like the perfect storm for having a disease like this.
And so much so that the city of Austin has named this Rosacea Awareness Month.
That's correct. The mayor has named it Rosacea Awareness Month. So,
wonderful. Thank you so much for being with us today.
You're welcome. Thank you.